The period of time starting from pregnancy and up to 1 year after childbirth is called the perinatal period. It's a period of great joy, but it also brings about huge changes and can cause much anxiety and emotional stress. 8 out of 10 women experience some negative feelings or mood swings during this period, and about 2 out of 10 women undergo depression. Perinatal depression is depression that occurs during or after pregnancy. It is not just stress or fatigue, and one can't just ignore it or snap out of it. Awareness and active management could help with the overall wellness of the mother and the entire family. The symptoms of depression could vary from person to person and could depend on a variety of factors based on each person's unique context. It is also often difficult to identify the symptoms because you can be preoccupied with managing the challenges and discomfort that comes with pregnancy or the postnatal recovery. You could mistake these symptoms for natural changes associated with this phase of life. Or you could just be too overwhelmed to notice. Your partner or close social circle might be best set up to watch out for you and ensure you get medical attention if needed. Ensure they too are aware of the symptoms and available to help. There are a wide range of symptoms that could signal depression. 1. Emotional signals could include persistent or reoccurring sad, angry, or empty mood, feeling trapped, overwhelmed, worthless, or incompetent, and or reoccurring negative thoughts. 2. Watch out also for behavioural changes, such as restlessness, lack of energy, withdrawal from loved ones, too much or too little sleep, too much or too little food, and loss of interest in things you generally love to do. 3. Loss in cognitive ability could include inability to remember, to think clearly, focus, process information, or take decisions. 4. Physical symptoms manifest as aches or pains, including stomach aches or headaches, reoccurring digestive issues that have no clear root cause and do not subside with treatment, onset of panic attacks and or obsessive compulsive behaviours. 5. You may have an anxiety disorder if you are experiencing a constant sense of dread, often feel nervous or anxious, or are worrying incessantly and unable to control it. This could come with physical symptoms, such as nausea, dizziness, or trouble sleeping or eating. While some amount of anxiety or negative feelings is normal in pregnancy and after childbirth, if these feelings persist more than 2 weeks, or if the symptoms worsen, become severe, and limit your ability to function normally, then speak to your doctor. Only a healthcare provider can determine whether the symptoms you are experiencing are of depression. The most severe cases of depression could trigger thoughts of harming self or the baby and require immediate medical attention and help. Remember, you are not alone, and any symptoms you experience are common during the perinatal period. You have nothing to be ashamed of or feel guilty for. Reject the taboo around depression and ensure you receive the help you need to feel better. Depression has a long-term impact on your health and wellness, as well as that of your baby and the entire family. It could impact your relationships, your career, and take away years of productive life. The longer you ignore, the worse it could get. Tackling depression actively and early will help restore your sense of wholeness and competence and allow you to continue living your life to its fullest.